Good afternoon, everyone. My name is Puspa Pokril, and today I am going to present a short presentation on cultural beliefs and healthcare challenges among Aboriginal and Torres Strait Islander peoples. So, starting with the introduction, first of all, I will pay attention to respiratory diseases as well as substance use, showing how enhancement and hindrance in health outcomes are shaped by cultural beliefs and practices. I will also critically appraise ongoing healthcare provisions and recommend ways to enhance health results taking into consideration the need for culturally competent care. So, starting with the introduction, in exploring this topic, it is integral to understand the scope of challenges that Aboriginal and Torres Strait Islander peoples face. I will explore the challenges with a particular emphasis on respiratory diseases and substance use. We will look at how traditional cultural beliefs and practices shape health behaviors and influence how these communities engage with healthcare services. The ultimate goal is therefore the assessment of current provisions of healthcare in view of their effectiveness in suggesting strategies that could lead to improvement. This focus will have to be on culturally competent care that can bridge the gaps. Talking about the historical and cultural context, I begin by considering the historical and cultural context that shaped the health experience of Aboriginal and Torres Strait Islander peoples, who constitute approximately 3.3% of Australia's population, according to Butler et al. 2019. The colonization experience among these communities has indeed been traumatic, with forced assimilation policies at its core, disrupting their culture and way of life. Despite this, cultural continuity is strong, and more than 250 language groups with innumerable spiritual traditions are still represented today, according to A.I. Yaman et al. 2023. This denotes cultural cohesion and plays a significant role in the molding of today's health behaviors and people's perceptions about the individual's state of health, disease, and how people respond to illness and to the healthcare system as a whole. So, moving towards how impact of traditional practices on health behavior. Talking about this in this context, it is obvious that traditional healing practices and spiritual beliefs continue to play a role in health behaviors among Aboriginal and Torres Strait Islander peoples. Traditional practices such as bush medicine and spiritual ceremonies are at the core of their approach to health and well-being, emphasizing the balance of physical, spiritual, and environmental health. Elders and community leaders play an important role in making health decisions, often advising whether one seeks traditional remedies, treatments from Western medicine, or both. According to Cox et al. 2022, the intersection between traditional practices and Western medicine has created barriers where there is a loss of trust, leading to greater disengagement from the healthcare system. This in turn amplifies the need for culturally competent care that incorporates and respects these traditional practices. So, talking about the health issues, the major health issues among Aboriginal and Torres Strait Islander includes the first health issues is respiratory diseases. Now, I would like to draw your attention to the particular health problems starting with respiratory diseases. Asthma and COPD remain two of the most widespread diseases among Aboriginal and Torres Strait Islander communities. Most of them have environmental factors and lifestyle conditions that create these diseases, according to Mehark et al. 2024. Overcrowding, poorly ventilated houses, high smoking rates, and environmental pollution are significant contributors to this respiratory condition. In addition, are the social determinants, namely mild access to quality healthcare and generally lower socioeconomic status, which further worsen these conditions. Any attempt or intervention to improve respiratory health in Aboriginal communities has to be specifically tailored to take into account the aforementioned contributing factors and provide cultural proficiency, especially to the most remote and underserved areas, according to Mehark et al. 2024. Moving towards the another health issues is substance use and addiction. Another critical health problem for these communities, apart from respiratory diseases, is substance use. The Aboriginal and Torres Strait Islander peoples are much more associated with illicit drugs, alcohol, and tobacco, along with the general population, according to Sneijder et al. 2021. This high prevalence is closely linked with historical trauma, socioeconomic disadvantage, and mental health problems such as depression and anxiety. Cultural sensitivities in offering either treatment services or rehabilitation services are held back, and in most cases, support for these who are struggling with addiction seems not to be realized. This places substance use as a sensitive public health challenge that demands immediate culturally tailored interventions that offer the needed support and care, according to Adams et al. 2020. Now, moving towards the evaluation of healthcare provision, with these issues, there is a need to realize the extent to which the healthcare services meet the respiratory disease and substance use needs. While initiatives such as the Indigenous Australians Health Program have laid important frameworks and increased the funding of indigenous specific health services, gaps still exist in healthcare delivery. Among the essential features of these initiatives are setting up indigenous specific health services, hence laying groundwork for improved health outcomes, some of which have been noted by Hunter et al. 2021. However, weaknesses persist at this point, particularly in the consistent implementation of such programs and the integration of traditional practices with Western medical approaches. Further, there exists a great mismatch between policy intent and actual improved health outcomes. While policies might be fantastic in intent, so much time is taken by a deficiency of cultural competency, thus communities' involvement is incomplete with ensuing results under what could have been expected enhancements in health according to Mueller 2020. Now, talking about the two major strategies for improvement. To fill these gaps, I have two main proposals. First, strengthening community based health initiatives by increasing the involvement of local leaders and integrating traditional approaches to health can improve health outcomes. A self managed process at the level of communities assures higher participation and helps to build trust in the healthcare system. Community led models reflected in such successful case studies as the Redfern Aboriginal Medical Service can make a difference to respiratory health and the reduction in substance use, according to McCalman et al. 2020. Secondly, investment in cultural competency training for healthcare providers is very important. This needs to be one that highlights understanding and respect for indigenous cultural practices and serves to provide that bridge that needs to be provided between traditional and Western medicine. The literature on the subject indicates that culturally competent care results in better patient satisfaction with care, increased adherence to a treatment plan, and healthier outcomes overall, according to Sahin et al. 2019. Now, finally, I would like to conclude by saying that in conclusion, I have tried to wade into the major health challenges of both respiratory diseases and substance use in the Aboriginal and Torres Strait Islander communities. To address this effectively, a healthcare system of true respectful inclusivity and embracing traditional practices that empower communities must be developed through health initiatives designed to suit the needs of these people. This will help improve the health outcomes of this community and restore faith among them. These are the references that I have used for my presentation. Thank you.